Hey everyone, in this video, I will be giving tips for nurses who just graduated nursing school. I'll talk about what I wish I knew during my first year of working as a new grad nurse and what I thought was very helpful in my practice and my everyday life. In this channel, I talk about all aspects of nursing from pre-nursing to postgraduate programs. If you want to learn more about nursing, consider subscribing and giving this video a thumbs up. I would greatly appreciate that. I also have a free 45-day NCLEX guide on my website, www.simplefitnurse.com, that you can download. Alright, so the first tip I have is to locate resources that you give to patients and know the resources very well. This will often teach you many of the patients you see, and it will educate you on different resources that your local hospital has to provide for the patient. Think about it. Your educator has spent a lot of time putting together resources for patients, and it would be very useful for you to know when to use them to benefit not only the patient, but yourself as well. The next tip I have is to bring a separate notebook to shifts, or take a piece of paper to your shift and write down things that you do not know. During the first year, you're constantly learning new things, whether it is new conditions or new drugs. Writing them down and studying them after work or on your days off will help you provide not only better care, but also practice more safely. A few things I did was I studied the pathophysiology of a condition and first-line treatments for that condition. This helped me for my NCLEX, and it also allowed me to quickly identify a theme of patients that we saw on the floor I was working at. Another tip that I can give for new grad nurses is to always consider the bigger picture. Your hospital has a lot of policies and procedures, and in school, you've learned how to do certain tasks in a way to protect yourself legally and the patient. However, these policies are meant to work 80% of the situations. There are situations that you will have that will make you question whether it is the best decision for the patient. And always think about what is best for the patient. That will make sure you do nothing wrong. I'm not saying go against the policies, but what I'm saying is sometimes look at the patient's presentation and think about the bigger picture. What are we treating with the patient? What is the purpose of my care for this shift? Asking these types of questions will help guide your decision making based on logic rather than policy. All right, the last tip I have for new grad nurses going to work is to help out colleagues as much as possible. You're a new person on the unit. Go out of your way to help help make other nurses' lives easier, and you will be rewarded with great friendships, trust, and you'll be able to take part in awesome learning experiences. I remember when I was starting out, I did everything I could to help the senior nurses so that they could teach me cool skills, and they always did. They always remembered me when they were putting a suprapubic catheter, an NG tube, or even a Foley, and they let me do it many times too. That is how I quickly became proficient at certain skills. I was nice to others, and they were nice to me in return. So there you have it. Those are a few tips I have for new grad nurses in 2021. Hopefully this video was helpful. If you have any tips for new nurses, leave them down below. I'm sure they would love to hear it. Thanks for watching, and we'll catch you in the next video.